I just sat here and talked to myself for 10 minutes, recorded an entire video that wasn't recording. So here we go again. Very common misconception in the nursing world is that all nurses are holistic nurses, which is what I have heard time and time again when nurses realize that holistic nursing is a nursing specialty. No, we're not all holistic nurses, and here are 3 reasons why. Number 1, we do not all know or are trained how to educate our patients on complementary and alternative medicine. Now we know that most of our patients, the majority of our patients, are taking herbal supplements, taking vitamins, engaged in some level of complementary or alternative healthcare. And there needs to be a bridge between the two worlds, westernized healthcare and complementary and alternative medicine. If all nurses are holistic nurses, then we should be the experts in doing that. We don't all necessarily have to be practicing these things ourselves or doing it in the setting we work in. We just need to know what these things are so that our patients aren't afraid to bring those things up to us. And we can educate our patients on what their options are when they are seeking options. Our patients should be able to turn to us to ask us questions about those things. And who better else to serve them than us? But you and I both know that nurses aren't doing that. And if we're truly all holistic nurses, we should be. I would love to live in a world where nurses were the experts on complementary and alternative options. But that's why we have the holistic nursing specialty. Number 2, we are not all practicing in culturally competent or culturally humble ways. This is a huge issue that is coming to light right now. It's June 2020. Now is the perfect time. It's a very, very ripe time to be talking about racism in healthcare. Beyond the scope of this video, but a huge tenet of my holistic nursing practice. We have to really come to terms with the fact that we're participating in a structurally racist system. And the fact that racism causes huge health disparities. And we can go into why that is in another video, but we need to talk about how nursing plays a role in that, how we're complicit in that, and how we also have a role in healing it and changing it. And that's why holistic nursing also exists. Now, I know that there's a lot of holistic nurses out there that really just focus their time and energy and their training on complementary and alternative health, but we need to be also leaders in anti-racism in healthcare. That's what we need to do as holistic practitioners. The biggest thing I really want to emphasize, I think, in this video is that there's a misconception that all nurses are holistic. And we're taught in nursing school how to treat the whole person. But if that's true, then we address things like the impact of racism on people's individual health, how structural racism includes the healthcare system, and how our practice has historically contributed to poor health outcomes for people of color. Holistic nurses have to embrace that truth and become the leaders of an anti-racist healthcare movement. And nursing has to really embrace that truth that we have participated in and been complicit in this. It's what I would say to anybody who tells me that, well, we're all trained to treat the whole person. Well, if that's the case, then we need to be anti-racist, because that is part of the whole picture of many of our patients. The third thing that is part of the whole picture of many of our patients that nursing does not integrate into our education and our training is trauma-informed care, trauma-sensitive care, and the fact that many chronic health issues have ties to adverse childhood events, or ACEs, and there is a mountain of really good research and literature on this fact. There's no reason why nursing education gets to ignore this any longer. And one of the main tenets of my practice as a holistic nurse is trauma-informed care, because it has to be. If we really look at the whole person, we really have to not only look at personal experiences and how those personal experiences change the nervous system, change the endocrine system, and change a person's brain to program their health, but also ancestral trauma, which links back to cultural competency as well. We have to really look at people's carried beliefs and stored experiences on a cellular level, and how that cascades through their ability to heal and their options for recovery. These three things are why I have chosen holistic nursing as a specialty. I am not board certified yet, but I practice as a holistic nurse, and there's a huge need for this specialty, because nursing education and the nursing profession as a whole do not have these three things woven in to our professional standards and our scope of practice, and they absolutely need to be. I would love to call for change. I would love to see nurses create more change and be the change makers around integrative healthcare, cultural competency, which is a term that I have a love-hate relationship with, but like cultural awareness and cultural sensitivity and anti-racism, and trauma-informed care. It's the least we can do. We can be the ones that actually treat the whole person, but unless we are tying these three facets together, we're just task makers and task doers and looking at the body and sometimes talking to our patients on a real level, but not really getting to the point of transformation. And that's where we could be. And I love to think of a world like that. If you like this video, make sure you give it a thumbs up and subscribe, because I'm going to be coming out with all kinds of content for holistic nurses, but also people interested like you who might be interested in receiving care from holistic nurses, as coaches, as educators, as the healers we are, and as the experts that we are in what we do. So I will see you in the next video. Make sure you subscribe.